based on how extensive of an operation he had and all the different moving parts and all the different parts that had to be addressed, we really couldn't have wished for a better outcome. Isaiah is a really delightful young boy that came and saw us. Now he has a very unique story in addition to a very unique congenital cardiac defect. And he actually had several congenital cardiac defects. Any one of these would have been exceedingly rare, but in the combination of these different defects stacked on top of each other really made his heart truly unique and really one in a lifetime type of cardiac defect that you would come across. So Isaiah's heart is actually positioned on the right side of the chest rather than the left side of the chest like it is for most of us. In addition, he had two veins that drained the upper half of the body as well as one vein from the upper body rather than just having one from each side. He had something called double outlet right ventricle, which is when both pumping chambers are actually pumping to the same vessel. For him it was the aorta. And he had pulmonary atresia, so the valve from where the right ventricle would normally pump to the lungs actually quite never developed during embryogenesis. He also has a large hole between the lower chambers, so a large VSD, ventricular septal defect, whereby the blood from the left ventricle passed through the VSD as well as the right ventricle and joined the right ventricle and passed blood into the body. And finally, what was very unusual about his anatomy is actually the ventricles, rather than being arranged in a side-to-side left ventricle on the left side, right ventricle on the right side, he had a superior-inferior orientation or configuration of his ventricles that we oftentimes call upstairs-downstairs ventricles, where the left ventricle was inferiorly located in a horizontal type fashion, and the septum was also kind of horizontally configured, and the right ventricle was actually superior. Isaiah really is doing phenomenally after his repair. Moving forward, he has really no significant cardiac lesions, and he really has normal function of his both ventricles. And anticipate that things continue to go forward. He really should be able to be a very active child who would be able to engage in sports and activities and really at this point have no restrictions.